postural, and other. Okay. Other is we can't help you. You need to go see whoever. Okay. Postural, you'll probably see, but it'll be the person that hurts when I sit like this, and then I do this and I'm fine. So you don't see a lot of those people, but they'll come into the chiropractor because they're stiff, right? You'll see a lot of dysfunctions and you'll see a lot of derangements. We're going to get through derangements first, then we'll jump into dysfunctions. All right. So who remembers what a derangement is? What are the characteristics of a derangement? I know it's been a week, or over a week. Okay, yeah. But what are that's more of the population, but what's the characteristics of it? So it is, yeah, so it's got decreased range of motion. What else? Yeah, not necessarily. So what is it? One, it has a directional preference, right? It's got a DP. It has a directional preference for sure. Whether that's extension, whether that's flexion, whether it's extension with this off center, if there's a lateral component, whatever, it's got one. Okay. It's highly variable. Yeah. The big thing with derangement is rapid change. These are the ones like you saw last week that come in, they can't move or whatever. You do some in-range loading and it changes. That's a derangement. Most people are going to be a derangement. Again, that's that 65 to 70% or derangement. And honestly, that's a little low. It might even be more than that. Right? It's a lot of the people that come in are going to be derangements. We treat a lot of derangements. That's why we can adjust them. Oh man, I feel so much better. Yeah, we just put you into extension, or we just did whatever we did. All right. All right. What else? So it can be intermittent or constant. It can be either. Right? It can be either. And you'll see the difference when we get into dysfunction and all the other stuff. You may see centralization. You may not. Again, it kind of depends on symptomatology. Again, it does have decreased range of motion. You'll see that in almost 100% of derangements. Okay. Now you have to determine what's a loss, right? If I have a super hypermobile dancer, her loss is not the same as his loss, right? If he loses range of motion, it's going to be blatantly obvious. If she loses it, it may not be blatantly obvious. It may be like, yeah, she's still got really good range of motion, but it's not normal for her. So make sure to take that into account. It can be acute or chronic. And then you've got the deformities. Who remembers the deformities? Yeah. Yeah. Kyphotic or lordotic, right? With those, older population, right? They're hunched over, right? They desperately need extension, right? In their thoracic, in their neck, desperately, right? We can help them with that. If they're like this, they're super old, they have to lean over all the time, they may need flexion in the low back. They may not. It all depends on how you assess them, right? Questions about any of that? All right, so is what? Oh, so this is derangement. Again, the most common one, 65 to 70%, probably close to 75, 80% are the derangements. Big things to pay attention to: directional preference, rapid change, loss of range of motion. Those are your big ones for derangement, okay?